A George Mason University baseball player has died from complications following a common surgery for players dealing with arm injuries. Freshman Sang-Ho Bayek died unexpectedly after Tommy John surgery to repair a ligament inside his throwing elbow. The typically routine procedure has become more common among young pitchers due to the stress that pitching puts on the elbow. Joined now by Dr. Garrigues. He's the team physician for the Chicago White Sox. Thank you for being with us, doctor.
Happy to be here.
So Tommy John surgery, we hear about it quite often. It's common, yet it's a serious one for baseball players around the world. But the news of a player having this surgery and then complications leading to his death is somewhat unheard of. What was your first reaction to this?
Well, obviously it's a tragic event. Anytime a young person passes away unexpectedly like that, I think this is very, very uncommon for this type of surgery. But we do have to remember that, surgery is an uncertain event sometimes. And even though the surgical side can be dialed down, some people have a predisposition to clotting. And if you're undergoing a surgery, your body might put you at risk for clots. And that's from what I understand, and I have not treated this patient, I may have played a role here in this case.
Yeah, you mentioned that. It is my understanding as well that blood clots led to this death after the surgery. Do you think that this particular player, that this particular case will lead to athletes not wanting to get the procedure done?
I don't think so. I think it's such a rare event, this tragedy, and that is obviously a very thankful thing. However, I think people always are hesitant to dive into surgery if it's unnecessary. But if an athlete's not able to compete, they're not able to do the sport they love without pain or dysfunction, I think they're still going to weigh the risks and benefits. Obviously, this is a very unusual risk, but this goes into that risk side. The benefits obviously are the ability to return to the sport they love if they're an amateur or that is their livelihood for professionals. So I think it's just going to go into the calculus, and obviously our thoughts or prayers are with this patient, his family, and teammates. But I don't think it's really going to change, how people approach the surgical decision. It's already one that's taken.
A little bit of technical difficulties there with the doctor, I believe. Doctor, are you still with us? All right. We have lost Dr. Garrigues. We appreciate him being with us, the team physician for the Chicago White Sox. Again, Dr. Garrigues, thank you for your time.